Hi everyone, welcome to week 3 of the Intro to Neurology course. I hope you've enjoyed week 2 and had the chance to review your understanding of the neurological conditions that are out there. As we said, there are quite a wide variety. Some of them you may not have ever treated, some you may not have treated for a while. So it's great to have that refresher. And that's kind of really key going into the next couple of weeks of the course. So this week in week 3, we're starting to look more at going towards the assessment and then further on into the management and treatment of patients with neurological impairment. Key to it, obviously, overall is what is the role of the multidisciplinary team in neurological rehab. Is it different from the other areas of physiotherapy you're working in? How important do you think it is? And really what is the role of the team in coordinating that whole rehabilitation process through that acute phase, and being that patients often are in that neuro rehab process for an extended period of time. We then go into looking at actual assessment of those neurological impairments, rather than going necessarily into specific assessment and outcome measures that we're going to use. It's more starting to look at what are the guiding principles behind neurological physiotherapy that will guide you in your assessment process, that then will allow you, in week 4 to look at what are the treatment options for that. Obviously, the key with assessment is about your clinical reasoning skills and what you use to actually determine what needs to be assessed in a patient. What information is it that you need to know? And what we're trying to do is give you a list of resources that you can use as refreshers to provide this. But the key that we're looking at in this is the use of the ICF, so the International Classification of Functioning by the World Health Organization on Disability and Health, using that as your overall framework so that it provides clarity around the process, so that it's very much patient-centred, and that you're looking at the components of health from both the perspective of the body, but also from the individual and the impact of society on that rehab. So it provides a really good framework for both your assessment process, but also going forward to the treatment later on. The other things that we will kind of just review during this week is there's a chance to go through the different, the step-by-step assessment protocols as a refresher for those of you who haven't been working in neuro for a while. And then a lot of it is about that learning from the more experienced practitioners who are doing this course, so that they can help develop their skills in mentoring other physiotherapists as well. So hopefully this week it's going to, again, get you thinking a little bit more about the framework that you use for neurological physiotherapy. That's really going to provide that good basis for moving on to the final week next week, which will be on treatment. The other thing we're going to have this week is an interview with Professor Lisa Harvey, which has been a really great interview to do. So she's got lots of information and updates, particularly within the area of spinal cord injury. So that's a lot to look forward to this week. And then finally, we are back to our case study again. So we'll see Stephen and Jane have some more updated information about their objective assessments and where they're at, to allow you to start to work towards, looking at what it is you need to do with these two patients moving forward within your rehab structure. So keep the discussions up. It's great to see so much discussion and people starting to feed back to each other in that discussion forum. It is a key part of the course, and it's a key way to help people with their learning and for you to start to get an understanding of the different processes that are used in different countries. It's great to see so many physios from around the world doing the course, so it's good seeing the different knowledge of what's happening in different countries at this point in time with neuro. And this is something you definitely want to see now in these next 2 weeks, which are key around those assessment and treatment options. So myself and Rachel will be there in the discussion forum all week. So again, if you do have questions, do pop them up there. The more questions you have that we can get answers to, the better for you as a clinician. And we look forward to seeing you next week. Okay, take